But one of the main things that we saw, like very quickly, was the brain chemistry just boom, started to come on and regulate.
Yeah. I, it's so interesting because I had a former guest on who was talking about the difference between not being sick and being well, and I think that what you're talking about there is taking people and seeing them move to a state of wellness rather than just avoiding being sick. Let me ask this then: what does quality healthcare mean to you?
Quality healthcare. Well, that's a good question. And I think, we talked briefly before we started this interview. And one of the things that my patients always asked for was more time. I want to be heard. I want to tell my story. I want some understanding. I want some explanation. And so they don't want to be just told, here, take this pill, take this supplement, they want to understand. They really want to have their power back, and that's the biggest thing that I've seen with my patients is like, just explain it to me. I'm smart enough to understand if it makes sense. They've been disempowered by the traditional medical establishment who has like 5 minutes, if that, to give to their patients, and they don't have time to explain why they're taking that medication or why they are told to do this particular diet. So quality healthcare to me means making that patient the center of, making sure that they're happy with what you're doing. They understand what you're doing, and they really get it why you're doing what you're doing, and they're a participant in the whole process.
Yeah, it's again, it's interesting because if you as the practitioner are not giving them the information that they need, they're going to go in search of that information. And when you talk about rabbit trails, when you hit
Yeah.
Google and you put in a diagnosis, there are so many different ways that you can go with this, so many different thoughts, and it it can be part of it can be unsettling because there is just so much information. But
Right.
part of it can also be very empowering because now people are seeing like, oh, there are other people out there that are like me, other people out there that experience what I have, and let's hear about what works for them. And listen, I have a disability, and one of the things that we talk about in the disability community is the fact that knowledge is power. And so in this day and age with Google, people are coming into the office with a lot more information because it's available. And when they're leaving the office, they have access to even more. But I think what you're saying is that the medical provider is no longer like the know all and be all of when you come in, they say take this and but now they are part of the the knowledge base, and they're more of a guide than they are a a definitive answer. So, uh, can you give me an example of quality healthcare?
An example of quality health care. Well, I think really it's giving that patient what they came for, So if they want blood work, they want genetic testing, they want, functional medicine testing, then you give them that. If they don't want that, if they want you to tell them what to do. Here, just take this supplement, do this thing, and you'll be better. There's that whole spectrum of what people want when they come in for a visit. So I think it's just putting the power in their hands, and giving them the driving, that make them the driver of okay, what can I do for you? How can I serve you best? What's going to make you feel the most supported by what I'm doing? So I think, it's having, like, I had a lot of tools in my bag. I had people that would come in and say, I want emotional work. I just want to clear these emotional issues because I think that's the core of what's going on with me. Like, okay, we can do that. Or I want you to test, as a muscle tester, we would test them on foods. Just tell me what foods are good, what foods are bad, and we'll go home. Other people are like, no, I'm in your hands. Tell me what is going on with my body. Give me the information to understand it. And they want me to kind of drive. So I think an example of quality healthcare is, again, putting them in the driver's seat and helping them as much as they want to be helped. And my partner and I, in my Happy Genes, the program that we developed for analyzing genetics, we developed a concept called a PhD in me. So Some patients want to know, what do I do when I have a cold? Instead of calling you, give me some ideas of things that I can do at home to take care of myself. And I love that concept. And I taught for years a kinesiology class for lay people because I wanted them to be able to test for just minor bumps and bruises and, tummy aches and colds and flus and stuff like that. We should put that back in the hands of people. And that would free up practitioners to really be there for the chronic stuff and the stuff that we need more help with.
It is so funny to hear you say that because you and I are on the same page here, and I'll explain. So, as a keynote speaker, I talk to medical organizations about patient and family centered care. And one of the things that sometimes, one of the presentations that I do is called Robology 101. And
I love
my
it.
my take on it is I have an advanced degree in me, which is exactly what you're talking about, a PhD in me. I've got my lived experience. I've got the knowledge that I have learned about, I've got a spinal cord injury. I'm a C5-6 quad. I have acquired the lived experience and I've acquired the knowledge of going through this whole thing. And when I come in to meet with a medical professional, there needs to be a mutual respect to say, I'm coming to you because you have an expertise, but you also need to respect where I'm coming from because I've got an expertise on my side, and it's mutual agreement. And the one other thing I'll mention is when you talk about putting the patient in the driver's seat, sometimes when they come in and they're asking for something, if you listen to them and they will tell you why they're asking for that, and that may open up a whole another realm of possibilities because they're asking for what they know,
Yeah.
and once you find out why they want it, it may really interface with what you know and open up a whole new realm of possibility as well. Uh,
Yeah.
what do you wish people understood about your role in healthcare?
Well, it's a really good question, Rob, because I've really done a huge paradigm shift since I got into the whole genetic piece. I really understand more about why we are the way we are and the compassion that it generates, for myself and my patients as well. Having suffered from depression most of my life, almost my entire life, I beat myself up about it. It's like, what is wrong with me? Why can't I just think positively? And we do that. We look at people and we go, could they just put down the donut and go out for a walk? Why are they heavy? And what I've come to realize is that there are often genetic variants. There's biochemical reasons why they're doing what they're doing. So there's this whole shift that I really want people to understand about thinking about these things as symptoms, not as faults. So, when I look at, again, depression, anxiety, all of those things, all those mental health kind of things, there's a reason for it. Usually it's a biochemical reason. And then we start to think up, oh, well, maybe it's because I had a hard childhood, or I was raped, or I was traumatized, or whatever. We have a story to kind of explain our physiology when it's actually backwards. If we get our physiology balanced, then the story becomes a minor player. We go, yeah, that happened. And we all know people who've been through traumas but aren't traumatized for the rest of their lives. So often it's a physiological imbalance that then kind of perpetuates those things. So it's about understanding what we would have considered faults in the past as actual symptoms of an underlying imbalance. So it's a little different.
Yeah, again, it's so interesting to hear you say that because you're right. There are two different people go through the same experience, and it affects both of them differently. Which is your example. Very interesting. What excites you about the future of healthcare?
I'm super excited about incorporating the genetic piece. I really am because there are some major answers under there, and it's again it's a paradigm shift. But I'm super excited because it gives us some really good answers for things that we didn't have answers for before. Like I say, I'm seeing things reverse that they said aren't reversible. I mean, I did a study in my clinic of Hashimoto's patients, and 100% of them reversed their Hashimoto's, and they say that can't be done. With autoimmune diseases, we're seeing them reverse. I'm super excited about, the brain chemistry piece because there's so many people suffering from brain chemistry issues, uh, especially now, after going through COVID and being isolated and, you know, not having our socialization that we need to kind of keep our brain chemistry balanced. So I'm super excited to bring a natural solution to those issues to the world rather than medications and diagnoses of, sorry, you're just going to have to learn to live with it. I'm not okay with that because there are answers. So
Yeah.
super excited about that.
Uh, yeah, such a powerful thing as we look towards the future. Uh,
Yeah.
Last question for you. What is one thing medical professionals can start doing today to improve the quality of healthcare?
Medical professionals, that's a pretty big, broad term. So I, I, I just really encourage, because I'm seeing the incredible value of looking at the genetic piece. And I know everybody's like hot on genetics right now, but really understanding that you can work with them. I would love to see the medical profession. So I designed this company called My Happy Genes that allows medical professionals of all kinds to look at the genes, and then the algorithm that we've developed gives them diet, lifestyle, and supplementation. So it makes it easy for them to implement a protocol. So I would love to see them start to use that because we're seeing that that is a foundation to start with, and then all the other things, all the other modalities they can use can be on top of that. But getting back to the listening thing, I think number one is just listening to our patients.
Yeah. Uh,
It really is.
Well said. And what I'm thinking about is from a genetic perspective. Sometimes people are given a prescription or told to do this and let's see if it works. Whereas if
Right.
you're looking at the genes beforehand, you may have an indicator that says this is more or less likely to work. And so rather than it's going to help you in finding the correct treatment plan for the individual and helping them to, as you said, helping them to be well instead of just trying to move them away from being sick.